Are you looking for an extreme blackhead popping experience? If so, this video is for you. In it, we'll discuss big cystic acne blackhead extraction and why it can be so satisfying to watch. We'll also explain how to safely remove blackheads and milia, and whiteheads, so you can do it yourself if you're feeling brave. So, if you're ready to get into the world of extreme blackhead popping, keep reading to find out more. The problem with popping pimples. Pimples, also known as zits, whiteheads, blackheads, and cystic acne, are a part of life for many people. However, when it comes to popping pimples, it can be a dangerous game. Popping pimples can cause infection and scarring, so it's important to understand the risks before doing it. When people pop a pimple, they are actually forcing pus and bacteria further into the skin. This can spread the infection beneath the skin and cause deeper, more severe acne. In addition, popping pimples can cause skin irritation and redness. This is especially true when the person squeezing the pimple uses their fingers, as this introduces more bacteria into the area. Furthermore, when a pimple is popped, the skin is vulnerable to tearing, which can leave behind a scar. It is also important to note that when someone pops a pimple, they are often not able to remove all of the contents. The leftover residue can become trapped underneath the skin and cause a new infection or further aggravate existing acne. Overall, it is best to leave pimples alone and let them heal on their own. If you feel the need to pop a pimple, make sure to do it safely and with clean hands. Why you shouldn't pop pimples? Popping pimples is never a good idea. It can cause skin irritation, spread bacteria, and even lead to scars. While it may be tempting to squeeze out blackheads, it can actually make the problem worse. When you pop a pimple, you can damage the surrounding skin and increase your risk of infection and scarring. The infection that results from popping a pimple can cause swelling and redness, as well as pain and irritation. In some cases, it can even cause an abscess, which is a painful pocket of pus under the skin. Popping pimples also introduces bacteria into the wound, which can further aggravate the infection. Popping pimples can also lead to long-term scars on your skin. These scars are called pockmarks, and they can be difficult to get rid of. Pockmarks are especially common after popping cystic acne, which is an especially large and deep form of acne. In summary, popping pimples should always be avoided. Not only can it cause pain, swelling, infection, and scarring, but it can also worsen the existing acne problem. To avoid these problems, it is important to let your skin heal naturally or seek treatment from a dermatologist. How to pop pimples safely. Popping a pimple is not recommended, as it can spread bacteria and cause scarring. However, if you do choose to do so, it's important to follow some basic rules for safety. First, make sure that the pimple is actually a pimple and not a cyst. Cysts are deeper and harder than typical pimples, and they contain pus. Popping a cyst can cause permanent scarring and even infection, so it's best to leave these alone. Once you know it's safe to pop the pimple, wash your hands and face thoroughly with an antibacterial soap. Next, sterilize a needle or pin with rubbing alcohol. Gently puncture the surface of the pimple, being careful not to dig too deep. If you notice any bleeding, stop immediately and do not try to pop the pimple again. Using clean cotton swabs or tissues, gently apply pressure around the sides of the pimple to slowly push out the pus. Be careful not to press too hard, as this can cause additional damage. Once all of the pus is out, don't forget to cleanse the area one more time with antibacterial soap or astringent. Finally, apply an antibiotic ointment and bandage to help prevent infection. Although popping pimples can be tempting, it's important to do it safely to minimize the risk of infection or scarring. Remember that if you're ever unsure about how to pop a pimple, it's best to seek advice from a dermatologist before attempting anything on your own. When to see a dermatologist. If you have deep, large, or cystic acne, it's important to seek professional help from a dermatologist. Trying to pop these types of pimples can lead to infection, more inflammation, and even permanent scarring. It is not recommended that you attempt to pop these types of pimples on your own. The American Academy of Dermatology recommends scheduling an appointment with a dermatologist if you have any of the following. Acne that covers a large area of your face or body. Acne that has caused scarring. Acne that persists despite over-the-counter medications. Cysts are nodules, large, inflamed bumps. Your dermatologist can evaluate your skin and prescribe medications or other treatments that are specific to your type of acne. This can include topical treatments, oral antibiotics, hormone treatments, and even laser therapy. It's important to discuss all your treatment options with your doctor and follow their instructions for the best results.